Test him 1.
Test him 2.
Test him 3.
Test him 4.
Yes.
Excellent.
Brilliant.
Excellent.
Love that.
We've got a podcast pro here, haven't we? In the shape of Huntriss, dietitian extraordinaire. And you have appeared on many, many podcasts, but it's taken us a while to get you here.
Yes.
That's for sure. And
In
welcome.
demand.
Yeah.
Thank you so much. I'm happy to finally be here. We made it work. We made it happen.
We did.
It's
only been about
Test him
a year in the making, maybe more.
Yeah.
At least a year. We saw each other at the Femtech event last year. Do you remember?
Oh, we did.
September
We've seen
last
each
year.
other many
Oh,
places.
well, many times. Yeah.
Yeah.
Careful what you say. It's been recorded.
Yeah. It goes out on air.
We are now live.
Yeah. But yeah, I remember chatting to you at that. So we've got to get you in the studio. We've got to get you in the podcast studio. So thank you so much for making the time and making it work.
Brilliant.
Thank you for having me.
Yeah, very much appreciated. So we're going to be chatting. I'm cautious to use the word nutrition because I know you're a dietitian, but we are going to be talking nutrition and food and nutrients and that side of things. I guess in some ways that therefore the first question's got to be, what's the difference between a dietitian and a nutritionist?
Okay, so to qualify as a dietitian, you basically need to do clinical or medical placements. So when I studied, I had three 12-week placements within a hospital. So basically, like, the curriculum is different because you have your general nutrition, but then you also have the medical application. So basically, dietitians, in essence, are trained to help to manage health conditions as well and to manage disease, whereas nutritionists, not so much. And with dietitians, so we're regulated by the HCPC, so the Health and Care Professions Council. So it's the only legally regulated nutrition profession in the UK. So in terms of nutritionists, so at the moment it's not a regulated title. So technically anybody can call themselves a nutritionist. If they like food, you can call yourself a nutritionist. However, I always advise people to look out for people who are registered. So, for example, with the AFN, the Association for Nutrition, so there's registered nutritionists there and associate registered nutritionists. So that means that they need to have done a degree that is aligned with that body. Yep. So, because it's so important to be going to people for advice. It's people that you should be trusting and people with the qualifications and people with the level of knowledge that is needed. Yeah. So yeah, it's kind of the Wild West on the internet, as we all well know. Yeah. So yeah, looking for kind of like credentials, qualifications, registrations is quite important. And that's, so obviously dietitians will be, but when you're looking at nutritionists, look for those who are qualified and regulated.
Sure, it's really, really important to know, isn't it? Really, because that, as you said, the internet is such a minefield of information out there, and when you're looking for specialist advice, it's so important to get credible advice, isn't it? So that's what we know. It
was the same when I was an acupuncturist, the acupuncture community. Again, it's not a protected title, so any Tom, Dick or Harry could go and read a book, buy some needles and
stick them in.
It's not protected at all.
Really?
Yeah.
Gosh,
that's quite scary.
Terrifying.
There were like, I did a 3.5-year degree course, and it was really complex, really in depth, conventional medical sciences within it and all sorts. But there are courses for 6-month course, go and do that. A couple of weekends and off you go.
Chuck a few needles and people and hopefully it works.
And I think that's a really important point, Ro, that you've kind of kicked off straight away, is like, do your research. If you're going to go and see a professional, and I kind of put that in inverted commas, do your research. Who are you? And I always used to advocate, because I did a lot of our safe practice stuff with the Acupuncture Council. I would advocate patients, grilling their practitioner. Don't just turn up and hand over your money, right? But where did you train? What qualifications have you got? What's making you... what experience have you got of treating this condition or supporting people? Yeah. So it's really important.
Definitely. And I think even thinking about the information that you're consuming online as well. So even just in terms of who you follow, this is where a lot of people get their advice from, where they educate people. So ensure that you're educating yourself from the best platforms. And there are, as we know, plenty of good ones out there, but there's some that can be problematic as well. Yeah. So do that research behind who owns that page.
Yeah, absolutely. Yeah. So what got you into it? How did you end up in this world of nutrition and food? And
so in terms of the nutrition and the food aspect, so what year did I go to uni now? Back in the 2005.
Don't have to disclose that.
Back in 2005, a sunny afternoon in Leeds. And yeah, my first degree was food science and nutrition. And I'd had an interest in kind of health and fitness. I used to do a lot of sport when I was younger. So I came into this degree and then I realised I really was not that fussed about the food science element, but the nutrition aspect I just found fascinating, because it really took me until 18, 19 to understand the impact that nutrition can have on health. In my 18 years before that, I honestly don't think I ever considered it.
Hang on a minute, hang on. 18, I would class as really early to get your head around that.
Yeah.
Because there's 30, 40, 50-year-olds out there.
True.
And beyond that are still, haven't got the heads around it.
But I only then learnt about it. I had an interest in it, but really I learnt about it when I was on this course. So this is the thing. You can, you can be of a healthy weight, for example. And this is what a lot of people guide their perception of their health by. They think, I'm a healthy weight, so I'm
good.
I'm healthy. Everything's good.
Yeah.
And then actually, when I was younger, God, some of the crap, I used to eat, because I did a lot of sport. So I thought, I burn
consume
loads
the
of calories, so I can eat loads of crisps, I can eat chocolate, this, that, and the other, because I'm just burning it all off. And technically, I'm in good shape.
Yeah.
But then that was why I really, really started to just love learning about then the impact that, macronutrients and then micronutrients could have on health. And it just really fascinated me. So then going back to our first point, at that point, I could have then gone working as a nutritionist. But because I was so interested in kind of like the implication of nutrition on health, I then learned about dietetics. Again, until I was in that degree, I was like, dietetics?
What
Dietitian? What is that?
Yeah.
So then at Leeds Met, which was down the road, I did the dietetics course, which was absolutely amazing. It couldn't have been more useful, more practical. And as I say, with those clinical placements as well, when you're working with people with health conditions, and then you're seeing the difference that nutrition makes to that, it was just, mind blown. I was like,
awesome.
right, this is the career for me.
Yeah,
and then following on from that, I did like a master's in advanced nutrition, and then I did a master's in clinical research, because we all know the importance of evidence-based science, and certainly in terms of fertility, a lot in terms of fertility, it doesn't exist there isn't like a guideline, a protocol to tell you everything. For those of us working in the space and who've been working in it for 5, 10 plus years, it's been about, looking at the evidence, like what is there, and then creating kind of like protocols and guidance based upon that. So the clinical research masters was actually really useful for me, bringing that together with the nutrition, to be able to really, really deliver on evidence-based care in a very emerging field.
Wow, incredible.
And was you doing sports still at this time? Was you still, you mentioned
I have injuries. I'm an old woman.
Oh, no.
We haven't got a little violin.
You didn't bring that up, did you? You just had to bring it up though,
thanks.
didn't you?
So during those studies, was you actively involved in sport at that time?
Yeah, like netball was my sport at the time.
Okay.
So yeah, still doing that.
And so kind of what you learnt throughout your studies at that point, I'm assuming you've made then your own good lifestyle choices, that you're not eating crisps and chocolate and just burning it off. But did you then find that you performed better? Was you more competitive? Like,
it's my injuries.
really? Oh, I'm sorry.
She pushed it too hard, Toby. Like you know, when you push it too hard, you get injuries, don't you?
You do, yeah. I'm injured at the moment.
Yeah. So sadly, I've got long-standing injuries that I still need to correct. But in terms of nutrition and then applying it to my life, I really did, and I think, compared to most people on my course, I feel like I was starting from a lower point.
From the bottom.
Everybody was eating their apples. I was eating my bag of McCoys. But no, I've made like got my diet now and my lifestyle now, you know, compared to where it was.
Yeah.
And, you know, there's still even changes that I'm making to this day. So I know you said that you were doing a podcast before with somebody about like endocrine disrupting chemicals. So it's like, you know, I'm really happy with where my diet is now, but I know there's still a lot of plastics that are in my life.
Yeah.
And even though I'm not trying to conceive, I am aware of the effect of plastics and other endocrine disrupting chemicals on fertility, but also there is evidence around their effect or impact on health.
Yeah.
Oh, absolutely.
So
Cumulative
now when I'm
effect.
thinking about, oh God, I take a plastic water bottle to the gym all the time. So it's like I'm aware of these things that I've now, only yesterday, I got myself a new better water bottle. So I'm
There
like,
we
right.
go.
So I'm still making, you know,
Yeah.
changes.
Yeah.
But I also think an important thing to note here is that like even as a dietitian, my diet isn't perfect. It isn't. And I very much live by the 80-20 rule, you know, still have some of the, you know, less nutritious foods that you may enjoy because it makes things sustainable.
Well, and it's living as well, isn't it?
It's living, exactly. And I froze my eggs, was it a couple of years ago now or 18 months ago. But then during that time, I tightened things up. So maybe having a few less treats, maybe, you know, I cut out alcohol like for a period of time. And I think this is quite relevant for people on a fertility journey as well, in that when you're making preparations for things or when you're in an active phase of trying to conceive, that's when we can dial it up a little bit.
Yeah, sure. Absolutely.
But again, you know, even when people are doing that, we don't need to demonize, you know, the odd thing here or there, but we can just,
It's
not
about being
optimise it.
aware, isn't it? It's about being aware of some of the impact that some of the daily choices that we make could have an impact on trying to conceive, and cutting down or cutting out could be really, really beneficial. Things like alcohol and chocolate and sweets and various other bits and pieces that can have an impact on BMI and various other things. And because it can have an impact on inclusion and exclusion criteria within an NHS setting if you do need IVF, if you need a bit more assistance than trying to conceive naturally. So yeah, it's really important to have that awareness, I reckon.
For sure.
So when did that interest in fertility kind of come in that kind of journey of your training and all your studies?
Yeah, so I started my career in the NHS and I was very much working in obesity and diabetes management generally. And so, full disclosure, I'm 38. And when
That was random, but
because there is a point. About 10 years ago, so when I was like late 20s, maybe 27, 28, that was when some of my friends were coming to me who were on a fertility journey, going through IVF and saying, I'm going through this. What can I do? What should I be doing to my diet? What supplements should I be taking, et cetera, et cetera? And I was like, well, I know the basics in terms of how to live well, eat well, you know, general healthy principles. But I was a specialist in other areas like gastrointestinal health, diabetes, you know, the things like
The
heart
big
health,
ones, especially
exactly.
in the NHS.
And
they're
this
gonna
is
be
what
the
you're
ones.
trained. This is what you're trained to do. But it very much opened my eyes to the massive gap in terms of support for patients that are on this journey from the lifestyle perspective. People were so, and taking, you know, my friends here as examples, they were so keen and so motivated to do whatever it takes to optimize their IVF to get the best outcomes that they possibly could. But for me at the time, I knew the generalist stuff, but I didn't know what supplements were best for IVF. I didn't know what could improve a low sperm count, or I didn't know specifically what could support implantation. So that was my prompt to then start to look on PubMed and start to look at all the studies that existed. I was like, you know, is there much here? And then I was just like, whoa.
Yeah, this is
The
huge.
sheer amount of studies, even at that point, you know, 10 years ago, I was like, there's loads.
And it's a minefield as well, isn't it? You know, there's a lot
And
of
it's like-
conflicting information.
There is. And I just felt that there were very few people communicating about it. So I spent probably about 5 years researching
Wow.
and building my knowledge on it. And honestly, I am a bit of a geek at heart.
We all are.
Yeah,
Tables
well,
like
that's
this.
good. I'm in
like
good
geeks at
company.
this table.
Yeah.
But on my Google Drive, I have the most amazing collection of research papers. I couldn't even tell you like how many there are for all sorts of different aspects of fertility, all sorts of different nutrients and their implications on fertility. And when I had all this, I was like, I've got so much, I've got to do something with it now.
Yeah.
So that was then when I set up my Instagram account, which is fertility.dietitian.uk. And initially, I just did that to share evidence-based information because that was what I understood was lacking. And there was maybe quite a bit of misinformation or claims that weren't necessarily, backed by science. So it just started as an information sharing platform, really, on evidence-based nutrition. And much to my surprise, it was received really well. So I was like, oh, this is cool. Okay. And then I started to grow a little community off the back of this then Instagram page. And then I started to understand the needs and wants of people who are on this journey because I was coming at it from somebody who hadn't been on a fertility journey. I was coming at it from a nutrition scientist, in essence. So I know how, my peers as dietitians, how they would like to learn, the information that they would want. But then I started to really listen to and understand what patients wanted, and then started to basically then create services off the back of that. So like different e-guides and meal plans specific to certain parts of the fertility journey, online resources, an online clinic. And then now I also do education for healthcare professionals as well. So I've got a course to support other people because I also have healthcare professionals following my page, and nutritionists and dietitians, and they're like, oh, like they really want, they really wanted to learn. So that was when I put the healthcare professionals course together. And that again has just been accepted so warmly. And I've had such great feedback off it because so many people want to help people on this journey, and it's an incredibly rewarding space to work in as well, because you're literally changing lives and you're creating lives. So it doesn't get much better than that.
It's like one of the best things ever, isn't it, is being part of this space. And that community is amazing, isn't it? There's some wonderful people in this space, and we've met some of the greats of that. And
I think there's further recognition really about lifestyle, diet and nutrition and the impact that can have in sort of trying to conceive in that area. And I've certainly seen over the last 10-15 years that more information coming through about nutrition and trying to conceive, and actually fertility clinics almost adopting a nutritionist to help them with their patients with diet and lifestyle. That goes beyond just the medical advice that they would offer as part of an IVF sort of cycle. And so it is becoming really, really important, I think, as a topic. But the more information, and there's more research coming out all the time, isn't there, about what impact on various things can have an impact. Certainly supplements and various other things is a big minefield. I think the NHS sort of like says, we recognise, folic acid and vitamin D is important, but there's a whole range of other, essential foodstuffs out there that can be supportive too, isn't there? So, it is really, really impressive actually where it's going now. Yeah,
I totally agree, and because we keep an eye on nutrition-related research within the field of fertility. Each month there's multiple studies that come out each month. Like every month there's a new batch. So I totally agree with you. It's like it's on the research roadmap for so many people. But it's just so important, and it just further strengthens and then can offer like new treatment innovations, etc. And I think with fertility clinics, because I think historically, and I mean, consultants are different, aren't they? Because some are very much in terms of like the medical management, which obviously, is a huge really part. But there are some consultants who are really pro the lifestyle, and there are some that pay attention to it less. But I think in time that we're getting more and more people who are the pro lifestyle and who are understanding how important this piece of the puzzle is. And I think I see this actually in general medicine as well, because doctors historically are very much like prescription or a referral onto a specialist, but we are seeing more medics come through with that understanding of the impact of nutrition and lifestyle. And I think social media actually helps with that.
For sure it does.
As well, because there's a big conversation around that. So I hope that positive trend will continue, which I'm pretty positive it will.
It will.
Yeah.
And do you find the other side of the fence of that with patients? Do you find patients are actually more receptive to that now? And in particular, men is what I'd be interested to know.
Oh, absolutely. And I do have to say, you know, the people that come to us in our clinic, they're just amazing. Like, everybody is amazing. They're so well educated, on fertility, and they've already got a pretty good understanding of, you know, this might do this or this might do this. And yeah, in terms of the male part as well, because we have one-on-one consultations, but we also offer couples consultations. And I would say over the past 18 months, we've seen a real increase in the number of couples consultations.
Interesting.
Which is when we see that, we're like, yes,
we're breaking through.
Exactly.
Yeah.
And now I think awareness, we've got a long way to go, but the awareness is growing in terms of the role that men play on a fertility or infertility journey as well. So we are seeing
that conversation is definitely changing, isn't it? I mean, I remember at the start of my fertility journey, I remember Katie doing her sort of research on it, and I was like, yeah, whatever. Like, my doctor said I've got sperm, I don't need to worry, blah, blah, blah. And literally just switched off to anything like that. And, you know, thankfully over time, I've obviously learned so much more. And since I've been involved with testing, just how impactful it can be. And it's great to see that there is a shift. You know, we're seeing guys come on our group chats now on our monthly forums, and the conversation is a lot more positive around diet and lifestyle. As much as we're kind of trying to drum that message home, but people are really receptive to it.
Yeah, we see people giving advice about what they've done now, don't we? We don't even have to talk.
Yeah,
we just open up the
on.
topic, and then you know, people say, "Oh, this is what I've done to to improve my lifestyle and benefits, and and feeling better about themselves." And so,
but I think I want to kind of come back to that point you made earlier about kind of living healthily, etc. as well. Is that when it comes to having a child, starting a family, and not just one, hopefully people can go on to have multiple if they're successful, is as much as upon success you want to live a long and healthy lifestyle so that you can then be a parent for as long as you can be, as healthy as you can be, but also to then help raise a healthy child. This doesn't just stop at just the conception. It's such an important part of the complete picture, isn't it?
Yeah, and I think an interesting fact as well is the diet that you consume and the life that you live can influence the genetics of your future children.
It blows my mind, that does. Yeah.
I know.
Yeah, it's so cool, isn't it?
I know.
Yeah, and
but it's habits and things like that, isn't it? It's called the epigenetics sort of factor, isn't it? About your traits, your style, your characteristics, your lifestyle and nutrition. Sort of, it will have an impact on that child for the rest of their lives.
Yeah,
but I think so it's a massive impact. Sorry.
So, but I think guys are still trying to get their heads around the fact that what they eat impacts their sperm quality, let alone the long-term health of their child. So, kind of what issues have you seen around that and the kind of misconceptions that men have and that kind of disbelief and disconnect? Are you kind of still dealing with that? Do you still have those conversations with men?
So I think the main barrier is, because I think in terms of what we see now people who are engaged, people who are informed, but there's so many people that still aren't, and men or even couples that may not understand the role that male factor can have in a fertility journey. So I think that's the first thing. We do actually see a lot if people have had the investigations and then they see the data. So they see that they've got
the numbers.
Yeah.
Exactly. So it's like we've got a low sperm count, or we've got poor sperm motility, or DNA fragmentation. That's I feel like men are actually quite receptive to that. Right, okay, there's the facts.
Need to sort that out.
What do I do?
Yeah.
And
solution mode.
Yeah, and I think people then most naturally go, okay, if I've got a low sperm count, the first thing that a lot of people do tend to think about is, let me think about my diet. Let me think about my alcohol consumption. And then think about, smoking or even recreational drugs or anything that I might do. And I think that is actually the first thing that people do tend to think about in terms of improving it. So yeah, I think we've got some way to go. But the people that are coming to see us, they're like, I'm ready to go,
Yeah.
kind of thing.
They're wanting some help at that point, aren't they? They've recognised that they're not going to be able to, conceive on their own, but they just need that little extra nudge, recognition, awareness, whatever it is, to actually help them get to that next step.
Yeah, and I do think like testing and just having that data is really important, because otherwise it's just like, okay, infertility, it's so vague, and then we just don't quite know where to target. And we're really specific in our approach. For some people, for women, it may be that we're concentrating on egg quality, or we may be optimizing like outcomes for egg collection, or we might be looking at optimizing the outcomes of a frozen embryo transfer. But then if we're working in terms of male fertility, it's really important that we know, is it low sperm count, or is it low sperm concentration, or is it low motility? Because the thing is, the treatment protocol, the foundation, say Mediterranean diet, lots of antioxidants, anti-inflammatory, is the same. But in terms of then the supplements that then may be offered, there's a slightly different evidence base depending on
what you find.
Exactly.
Yeah. And it is all about that diagnosis, not just the diagnostics, but the panel of diagnostics alongside medical history will give you a picture about what could be the root cause of low motility or low morphology or other issues, by just getting a normal sort of like history, as well as medicines that they may be taking, exercise, diet, lifestyle, all the different factors that we need to explore. Not just that there is a count that's a bit low and okay, right, fine, you've got some, so we'll just go for an IVF cycle and see what happens. But yeah, it's so important, isn't it, to get those metrics and to understand those metrics and figure out what that root cause is.
It is, and I think that's a really important point, because we support people if they come with X, Y, or Z issue that they want to resolve, but we always like to do that alongside their medical management. So the fact that they're under their, whether it's GP, fertility doctor, consultant, whoever it may be, because we can look at this side, the diet and lifestyle, but for some people there may be underlying or other issues that nutrition can't fix. And we're very transparent in that. If you have a varicocele,
that's a medical intervention you need, right?
Exactly. We can still help with your general fertility, but taking a supplement isn't going to fix that.
No, it can mask it, can't it?
It can
actually
support
support it. It can maybe reduce down the oxidative stress, which is being created as a result of heat stress, for example. But it won't ameliorate it, and it won't go away. As soon as you take that supplement away, the issue will still be there, won't it? So there's definitely root cause which needs to be identified. Is it a medical cause, or is it a lifestyle nutrition cause? And treat that cause, not just the gametes that come as a result of it.
Yeah, it's about kind of less of that shotgun approach, isn't it? Let's just chuck everything at it and hope something works. How many people that are out there that just take 1,000,001 different supplements because someone says they work, but actually you might be doing more harm than actual good. And it's exactly why I drum it home all the time about knowledge is absolute power in this space, and understanding that full diagnostics and that full picture allows professionals like yourself in this space to then actually tailor it. It's the correct way to go, because otherwise you're just chancing on it.
You are chancing, and it's a delicate balance, isn't it? And we were talking just off camera, really, weren't we, about the importance of lots of people talk about oxidative stress, but they don't talk about reductive stress,
exactly,
which is equally as damaging as oxidative stress, and it's about the ups and overs, isn't it?
Yeah, absolutely. And because I think innately as humans we're like, okay, more must be better, and it can be said for kind of like other supplements as well. We just see it so much, but in the particular, because in terms of poor sperm quality, one of the main drivers of that is oxidative stress. So then we know that antioxidants, that particular nutrients that we find in our diet, supplements, can then counteract that, which is great. But people can go too far.
Get carried away,
and as you say, like you end up with the same issues. You kind of like you go past where it's good,
and then yo-yoed beyond it, haven't you? Yeah,
exactly. So I do think that is an important discussion to have. But even things like vitamin D, for example, I see, and this is, maybe we see this more with women, but in terms of like nutrients, most nutrients have a safe upper limit. And sometimes, you know, you can be taking, I see women coming in taking a high dose vitamin D supplement, which is right at the safe upper limit. And then they're taking a prenatal supplement that still has quite a lot of vitamin D in it. And then they may be taking another supplement that's got some more vitamin D in it.
Yeah.
And it's fortified in their food, perhaps. 'cause
And
they're
it may be,
buying-
in their cereals or wherever else the source is,
Exactly. So yeah, more isn't always better.
Yeah, it's a bit like guys that are in the gym. You know, they need about 150,000 grams of protein a day just to grow a grams worth of muscle. You know, eat some chicken and eggs and do it properly. And it kind of that's the analogy I always come back to. Is that and maybe that's relatable to our listeners. Is that you just need to be sensible with it. And
well,
take
I think there's two
professional
words
advice.
that I always remember is insufficiency and deficiency. And if you can measure it, when a lot of these things you can measure, then you know what you can supplement safely with. And I think that's an important thing, that if we don't do the diagnostics and work out what is insufficient, deficient, or in over excess, then we don't necessarily what we're doing by taking supplements or anything else like that. So it's appropriateness.
Because it's all about balance.
It's balance.
You know, we talk about balanced lifestyle and diet. This, again, it comes back to that, doesn't it? I guess.
Yeah. And I think, well, taking vitamin D as an example, so it's actually a really common deficiency. I think it's like 1 in 6 adults in the UK have a vitamin D deficiency.
Why is that? Do you know? Is there a?
Because we don't get any bloody sun.
Outdoors, it's raining.
Apart from this summer, it's really sunny.
Yeah, I mean, I'm ginger. I stay out in the sun. I'm probably massively
Yeah, will be. Yeah.
So vitamin D is the only essential nutrient that we can't get sufficient amounts of from food. So you can get small amounts in certain foods, but we rely on sunlight in essence. So we can synthesize vitamin D, but we need the sun's help from that. So basically, we're advised during the spring, summer months to get out in that sunshine a little bit so that we can then build up our levels of vitamin D. But then during the winter months, we can't synthesize that.
Because we're in England.
Because there isn't any sun.
But
that's why public health guidelines say that everybody, like all adults and children as well, to have a vitamin D supplement. So for adults, it's 10 micrograms daily. And you know, some people don't know that. And then on top of that, so if somebody's deficient, and you know, you can be deficient for a lot of other reasons that could be kind of like medical, genetic, anything like that. So, but for some people, even if you're taking that 10 microgram supplement, that doesn't necessarily correct a deficiency. So you may need a much higher dose than that. And again, this is where testing is actually really important, and we really encourage this actually, in terms of, you know, vitamin D, vitamin B12 as well being a common one, folate status, etc., because all of these play a role. And just because you're taking a supplement that contains it, it doesn't necessarily mean that you're going to have healthy levels if you have a pre-existing deficiency.
Yeah, absolutely.
And what's the most efficient way of finding that out?
Testing.
Is it just purely a blood test? Just for our listeners, really, just to explain.
Yeah, definitely. So I like to say, you know, at first, because some people can get these tests on the NHS and going to your GP. So if you're going in there, you know, with a reason, then people, you know, doctors will often screen, and especially if people are on a fertility journey as well, you know, getting vitamin D, hopefully B12. And then you may be able to wangle a few more if they're happy to do it. So say, you know, like for women it might be like folate and iron, like ferritin, for example. So, you know, sometimes you can do that, but there are loads of really good like at home testing kits that you can do. I like to do it actually every now and again, maybe every year or every couple of years or something, just to check my nutrient
baseline.
status. Exactly. Even as a dietitian, because when I first did a vitamin B12 test, so I became vegetarian when I was like 8, so really young. But because I had, you know, I ate eggs, I consumed dairy, so I thought, and I love cheese. So I was like, I'll be fine. Because B12 you can only find naturally in animal products. So I thought it would be fine. And then I was shocked actually to see. I was like, oh, my vitamin B12 levels are low.
Right.
I have actually since introduced fish, mainly actually like for nutrition reasons. But I started to take a supplement after that. And then, I've actually introduced fish as a result, but I didn't know. I was also vitamin D. I think I was more insufficient than deficient.
Yeah.
But I was like, right. So it just, it really made me pay attention to things. But this is the thing. We can live, we can feel well, but there are some things that are can be going on in our bodies. The only way that we will know that is through a test.
Yeah.
And I think the scary thing about vitamin B12, so in terms of a fertility journey, this is both for men and women, but a vitamin B deficiency is a risk factor for infertility in both men and women. So that's something, by correcting that, it's again just one piece of the fertility
the
puzzle.
gain that you
Plugged in. But also, if you have a vitamin B12 deficiency over decades and decades, this can cause neurological problems when you're older. It can really, really have a negative impact on your health, on your quality of life, potentially your lifespan, your life expectancy. And so many people don't test, but blissfully unaware. Exactly. And we only know what we know.
Yeah.
That's it, which is why I think, having these conversations is really important.
Yeah. And I think it's only when you have a problem that you recognise that there could be something else that's underlying. And to get these health checks early, you know, is really, really important. And it may not be offered, as you said, by GPs. Not all GPs will have access or provide access to a panel of, essential tests. So by going to somebody like you and being explained what the importance of some of the advanced testing or testing that's not necessarily offered through the NHS could just unlock that answer for them, couldn't it? And get them on the right path.
And typically among men, really, we don't like going doctors the best of the time, do we? We're pretty rubbish, yeah. And it's just so powerful hearing you say that, because actually I've not been tested for that, and it's actually made me want to go and jump and get tested.
I've got to go and get tested again. I know I should have done that probably last month, but I need to do it this month.
We're all here to learn, aren't we? And I think it's a really powerful thing we've just said there, because obviously, yes, in this space we're talking about fertility, but equally, when I'm 80 years old and hopefully longer, I'm still able to kick around a bit more. It's all important.
And sorry, Ro, you mentioned earlier, if you're looking at sperm concentration or then sperm motility, there are different nutrients that are at play. And it made me think of actually, when you're in the NHS, you're saying, well, if you're treating a specific illness or condition like diabetes or obesity, you're looking at specific supplements or nutrients. Yeah. And vitamins. So how does that work in terms of male fertility? In terms of what nutrients do men need? What should they be thinking about?
Yeah. So, taking the example of working in the NHS with more mainstream health conditions. So if somebody's got diabetes, then we're thinking about weight management. We're thinking about total carbohydrate consumption. We're thinking about glycemic index. So that's like the rate at which the glucose is released from a carbohydrate containing food. And interestingly, it's very much kind of energy balance, so calories and then macronutrients. Honestly, micronutrients are barely discussed because it doesn't actually, micronutrients don't really have that much of an effect on blood glucose levels, which is what you're trying to treat in that particular patient. And then, in terms of blood pressure, it'll be different. In terms of cholesterol, the things that you'll be focusing on, different. With everything, there's the fundamental healthy diet. And, we talk about the Mediterranean diet a lot, that everybody should be having. But then in terms of, to give an example for DNA fragmentation, the kind of nutrients that I've got good evidence behind them in terms of supporting DNA frag is higher dose, but vitamin C and vitamin E, also coenzyme Q10 as well. And, the reason why is oxidative stress is kind of like a key risk factor for DNA fragmentation. And vitamin C, vitamin E, coenzyme Q10, these are powerful antioxidants. So it makes sense.
Yep.
And then, there's just slightly different variations for whether it's, sperm count or sperm concentration. And this is just, there's like meta-analyses that in fact, there was one that came out on coenzyme Q10 literally in the past couple of months. And coenzyme Q10 is known more so, I think, in female fertility. Again, coenzyme Q10 is an antioxidant. And similarly for women, when they're looking at egg quality, oxidative stress is kind of a risk factor for poor egg quality.
Correct, yeah.
And in terms of coenzyme Q10, it's an antioxidant of which we have levels in our body. As we age, coenzyme Q10 levels drop. So this is why, in particular, we find benefit of women over the age of 35 supplementing with coenzyme Q10 because it kind of counteracts the oxidative stress on the egg. But with this paper with male fertility, so it's a systematic review and meta-analysis, so a study that combines the results of lots of different studies. And they basically concluded that coenzyme Q10 was effective in improving sperm count, sperm motility, and sperm morphology as well. So as much as that's, that supplement is very much plays a part in female fertility, I think we're going to see it more in male fertility too.
I'm so desperately trying to not reach for our box of our supplements back there because these are the key ingredients within Testing Men Plus. But exactly for this reason, because it's been designed to manage oxidative stress. But this actually then goes all the way back into the conversation of testing. Because actually, and this is, so there'll be guys might listen to this. Okay, great. I'll go out and buy some coenzyme Q10. I'll go and get some vitamin C. I'll go and get some vitamin E, and I'll pile that into the system. You've got to test beforehand, ideally, and you can have your seminal fluid tested for oxidative stress to find out if it is a factor. Because and this is where some of these studies have come undone, isn't it? Where they've taken a cohort of men, they've chucked them on vitamin C or coenzyme Q10, and then the outcome of this study is vitamin C and CoQ10 doesn't impact sperm quality. Because actually there was a huge bunch of men in that cohort that hadn't been screened, or none of them had been screened.
Yeah, that had normal levels anyway.
Had normal levels
of
anyway.
oxidative stress.
And then actually could push them into reductive stress.
So that's why this important. This level of testing is really important. And a lot of men and couples, we have this conversation time and time again. It's like, well, what's the point? What's the point of doing these tests? These tests are expensive. I put that in inverted commas because actually I think ICSI is rather expensive. Yeah. An oxidative stress test and a DNA frag test isn't expensive in comparison to that. But they're not encouraged to have these tests, potentially at the clinics and obviously the GP because well, we'll just do ICSI, we'll just do IVF. And I think and what's the value? Where's the research?
Yeah, and I think that's just lack of guidance, really. The UK has been quite poor at adopting guidance from research because it's predominantly been in a female sort of orientated fertility world, and there's been less money being spent on research, certainly in andrology and some of the ideas of micronutrients, macronutrients, and the impact that can have on sperm quality. And even though there is data out there, it's really difficult to try and isolate from foodstuffs, which is going to be beneficial for some men and not other men. And the sort of main problem for me is that there is still this lack of diagnostics being utilised in NHS settings to actually identify these insufficiencies and deficiencies, and we know what we can replace them with. And I think the other part, just coming back to sort of like things like coenzyme Q10 and other sort of essential sort of micronutrients and everything else, it's so important in terms of the biology as well, in terms of the creation of sperm. Creation of sperm is over about a 72-day period of window, but where sperm have the most of their maturation is in the epididymis, is in the collecting duct of the testes, and that is where the absorption of the micronutrients actually happens. So if you've got incomplete, insufficient, deficient type of micronutrients in your diet, then the sperm can't actually get the nutrients for maturation, and therefore will have an impact on the creation of that DNA that's integral for fertilization and creation of live birth outcomes and so forth. So micronutrients and essential nutrients and essential elements are so important, and if we don't know where they are or what is going on in the body, how on earth do we know really what we're doing by any of the procedures in IVF? And really it's the roll of the dice, isn't it, sometimes?
But also actually, funnily enough, I saw this on Instagram yesterday that whilst the sperm are being produced within the testicle, so in the seminiferous tubules and all that, they're relatively safe. They're in a
They are.
protective environment.
They are, yeah.
It's when they come out into the epididymis, which I always class like the finishing school for sperm. That's where they learn to swim.
I love
and,
these acronyms, these little things.
But yeah, that's where they can pick up the micronutrients. But that's
it.
also where they're exposed to the most amount of oxidative stress.
Correct, yeah.
So it's really important to understand that, you know, that they're very, very vulnerable at that stage.
Yeah.
And there's parallels as well with female fertility. So as you've just described the context of male fertility, with women, our diet influences the follicular fluid.
Correct. Yeah,
So basically, you know, like where hopefully the antioxidants are. So then when the egg, the oocyte is growing, is developing, it's sucking in from its surrounding, and that's where it gets its nutrients. And you know, you could turn the potential of oxidative stress into something that, you know, the antioxidants could then counteract, and then you've got a much better, like, healthier
environment.
egg. Exactly. And the same,
right.
you know, same goes for sperm in that context as well.
Yeah. I mean, it coexists. The oxidative stress coexists in both, you know, men and women, and we know that from some of the prenatal studies that we've got on some of the supplements that we've had, and the impact that you can have. It's not just what you get, you're born with the eggs. You can actually influence the quality of those eggs over time as well. And certainly when you're trying to conceive, you know, certainly a couple of months before trying to conceive, you can improve that egg quality. You know, you can change AMH levels, which is interesting.
Yes.
And you know, there's a lot of physicians that say, no, you can't. It is what it is. And you go like, well, actually, you can by, you know, modifying the hormonal levels and nutritional levels and various other things, and you can improve egg quality. So yeah, it's an interesting field, isn't it?
It is. It's amazing.
How do you help men get their head around this? So when they have come to you and they kind of understand to some degree that, okay, wife's been nagging me, I need to do something. How do you help them get their head around this?
For people that tend to come to us, you know, they may have questions, but a lot of people have maybe done a bit of reading beforehand as well. We do have people that come to us quite informed. A lot of people just like a bit of when it comes to men, like a protocol.
Yeah,
just
tell me what to do.
Tell me what to do. Like, no problem.
Give me the Haynes manual,
There you
I'll
go.
follow it.
Exactly. Whereas consultations with women, they tend to be a bit more emotive. And kind of really going into kind of like background history a lot more. And some men, which is, you know, great when, you know, they open up and have these conversations too. But I would say for the most part with men, it's quite practical.
Yeah, I think so.
So, and what would those practical tips kind of look like from your side to a guy?
So, you know, we've spoken a lot about supplements, but actually the foundation is the diet, actually where we need to start. So it's looking, you know, we'll do a diet history and then we'll look at, okay, what does the diet look like at the moment? So food and also drink as well. And then the model diet that we're trying to achieve or get towards is the Mediterranean diet. So it's thinking about the different swaps that we need to make. So for example, you know, first of all, looking at how many portions of fruit and vegetables are they having in a day? And then, okay, so we'll need to, that will be one of the goals. And then other things in terms of the med diet is whole grains. So if they're having more refined grains over whole, then that's something that we're going to bring in. If they are, you know, we want to be having more unsaturated fats than saturated. We want to be including oily fish, like nuts is a key one and an amazing one.
We love talking about nuts, don't we?
Yep. Because there was a randomized control trial a few years ago now, but showing that consuming 60 grams of nuts per day had incredible effects on sperm quality and on a variety of different parameters. That was the one change. That was the one change, and the diets remain the same. So definitely ensuring that that's part of the diet. Seeds as well, legumes, making sure that we don't have too much saturated fat, because this is, you know, this, oh God, like the carnivore diet that we see a lot of.
Been there, done that.
And when,
Ian and I do like the carnivore diet every now and again, but all in moderation. Yeah.
And that's it. But in terms of fertility, so that's a diet that's high in saturated fat. A high saturated fat intake is associated with poorer sperm count and sperm concentration. Never mind the metabolic health implications of increased cholesterol, etc. But also with the carnivore diet, like, you don't, you know, where's all the antioxidants, you know, like the fruit, the vegetables, the legumes. the herbs, the spices. So you know, we need all of this. So in essence, going back, looking at each of the different principles of the Mediterranean diet. Where are we? Where do we need to be? So creating an action plan based upon that.
Yeah.
If we need to make any changes to, like alcohol consumption, things like that, we'll look at it.
Yeah.
Then we'll be looking at specific supplements and what may work for them. We do encourage testing if that hasn't been done, but ideally that would kind of like be done before. But then also looking at wider lifestyle management as well, just, you know, generally in terms of being active, but also ensuring that they've got the knowledge in terms of keeping sperm healthy, just in terms of temperature, you know, what they're exposing them, you know, themselves to in terms of like laptops, for example.
Even
like
phones in the pocket and things like that.
Saunas, all these kind of things. So covering that. We don't, in terms of the conversation around like endocrine disrupting chemicals, we know that it plays a role. However, you know, all the things that I've just discussed there, that's already a lot.
Yeah.
So I think with certain things, even though that we know things that can play a role, we're quite considered in terms of when we have certain conversations. And it can be useful to maybe have more than one. Because there's often quite a lot to cover. And also checkpoints can be good anyway.
Absolutely.
Yeah.
I remember that with my patients, like, because I would do a lot of lifestyle and diet stuff around my acupuncture as well. In fact, that's the stuff I really enjoyed, like how to help people change their routines around what they eat and how they eat, when they eat, what they, the movement they're doing, all these kind of things. And you give them too much, it's
just
really
overwhelming, isn't it?
Absolutely overwhelming. And it's kind of, I always remember an old NHS advert of somebody trying to stop smoking, losing weight on a treadmill, like in January. It's like, it's too much. And having worked in sports centres as well, like the gym is absolutely rammed from January to March, and then April you're back to all your regulars. It's hilarious. People queuing up for treadmills. So you do have to take it in manageable chunks.
You do. And I think, you know, in terms of like any dietitian, when they're then creating that plan, it's about creating a joint plan. Okay, so these are some of the things that we can do, and then jointly let's create the action plan that you're going to go away with. And sometimes it's like the low-hanging fruits, or what's the kind of like, you know, are we having no fruit and vegetables? Let's really focus on that. And the things that, you know, are going to be manageable to integrate into somebody's diet and lifestyle, but also those things that we feel are going to have an effect.
Yeah,
definitely.
I've said to guys before where they've had, you know, they're like, oh, I'll have a bit of Weetabix for breakfast. Okay, that's all right. It's not fantastic, but it's okay. Stick some blueberries on it.
Yeah.
Stick a seed mix on it.
Yeah.
There you go. You've upped
It's
it. Just,
supplementing it,
you
isn't
know,
it? Just
It's a
in
gain,
some ways.
isn't it?
Yeah. And for them, it's like, oh yeah, I can do that. That's easy. Whereas you say to them, right, look, you need to do overnight oats, and you need to do this and that, and you add. No, they're not going to do that. You know, what's the biggest thing that men are like? Oh, I really don't want to give that up. Do I have to?
Beer.
I thought that would be the
it's going to be, isn't it? That is the big one.
But men get it easier than women in that respect, because the advice for women is to abstain. In terms of men on a fertility journey, it's to avoid high alcohol consumption. But the studies that I've seen in terms of where there can be an increased risk of poorer outcomes or an increased risk of like poorer sperm quality is over 8 units.
Right.
In a week. So it's like, if we want to, you know, general advice, you know, stick within your like public health guidelines for like 14 units a week. If we're looking, you know, fertility specific and we want to go where the evidence lies, we say, you know, like limit to 8 units really, if you can. So, you know, it's nice that they get that you guys get that. It's it can be difficult.
And actually,
low or zero. Because they're alternative beers and
alcohol-free beers.
Alcohol-free spirits as well. You know,
is it really?
Yeah.
What's the point of that?
That's what I thought. It's just the flavour. It's just the taste.
But I did an article on alcohol and male fertility for our website, and the research I looked at was saying that actually some of these alcohol-free beers have potentially got antioxidant qualities.
Yeah, they do.
They're actually, so they're actually potentially good for you. Well, good. You know, but it's
remove
like,
the alcohol. Actually, the you know what's left behind it is root beer, isn't it? Really, it's hops and wheat. So Getting
If
some
I am
nutrients.
going to
Healthy.
recommend an alcoholic drink, because obviously men can still consume some alcohol, really, if we're looking about those thresholds. But with red wine, it's got the highest amount of polyphenols and resveratrol, in particular, which is an antioxidant. And when you think about like the Mediterranean diet, as it's well known, red wine is actually a part of that. We obviously
true.
kind of like take that out for fertility advice, certainly in terms of women. But for men, if they're wanting something, they're wanting an alcoholic drink, but maybe want a few benefits as well, then I'd say that
Just
would be
swap it out
the
to
one to
that's the
go
little
for.
cheat hack.
Yeah,
But
cheat.
still,
That's the
more
right
is not
tennis.
better.
Absolutely.
Yeah, not a bottle every night.
No, certainly.
That's a bit more than 8 units.
Yeah.
It is.
And I think you mentioned to me, might be in our emails, that you've been doing some work around recurrent miscarriage as well. Is that right? And the role of sperm in that and male fertility.
Yeah, so I think that's a really important conversation to have. Historically, and I think, still now to a degree, when it comes to miscarriage and when it comes to recurrent miscarriage, everybody thinks about the woman and the onus and the responsibility is very much placed on the woman. And also women take this responsibility
feel
as
it,
well.
yeah.
They're like,
Yeah,
oh
big
God,
shoulders,
yeah, absolutely. But, we were having a conversation around DNA fragmentation, and, there has been a lot of research actually building in recent years around the role that high levels of DNA fragmentation can have in recurrent miscarriage. And there was a new systematic review and meta-analysis that came out, again, I think it was a couple of months ago, just highlighting and confirming that men with higher levels of DNA fragmentation, well, basically people with recurrent miscarriage, they're more likely to have higher levels of DNA fragmentation. But interestingly, in this study, it wasn't just that. People with a lower sperm volume, on average they had a lower sperm volume, also motility, morphology as well. So there are other aspects now we're learning of sperm health that could be associated with higher levels or higher rates of or chance of recurrent miscarriage. So I just think it's important to highlight, because the woman is generally like, what can I do, and sometimes there can be an answer that we may not be aware of.
Yeah.
And this is when it comes back to, as we were saying with testing before. And
The importance of it.
I am an advocate for DNA fragmentation testing. I'm not saying that everybody has to or should do it, but I certainly think there's a place. And when people are looking for answers, this can sometimes just help to paint a clearer picture as to what's going on.
And there was some really good guidance, I think, for ESHRE published a separate report on recurrent miscarriage and indicated that even with normal sperm analysis, as you would normally do it through the gold standard sort of sperm analysis, looking at DNA fragmentation, there did seem to be a cohort of patients with normal sperm parameters, but with high levels of DNA fragmentation, which was associated with a higher level of recurrent miscarriage. So, there is, seems to be a very strong association, not a reason, but an association, even in the absence of a normal semen analysis. There could be other factors that's going on, and the integrity of that sperm, not just how many you've got and whether it's moving and whether it looks the right shape, is also important to consider. So for certain patient cohorts, especially when you've had recurrent miscarriage or a miscarriage, it could just give you that biomarker that you need to understand that actually there could be something else that's going on here that may need further investigation by more of a specialist, like an andrologist or something like that, to see what else is going on there to investigate and see whether that needs treating. And certainly what we see in a large proportion of patients with varicocele, for example, often they do have normal parameters, but they're also struggling with, heat stress as a result of the varicocele, the extra blood vessels in the testes or around the testes that's contributing to heat, which does actively have an impact on oxidative stress and denatures the sperm, even though you've got plenty in the factory being produced. So it can give you some extra information that is absent from just a normal sperm analysis that you get in a clinic.
Yeah, and I think it kind of goes full circle as well, because that kind of information, just from a psychological perspective, is in my opinion healthy, because it gives you that knowledge and understanding of, okay, this is why. Coming back to that point about how women tend to hold that burden that it's their fault. having that information that actually there is a high probability that potentially it's the man here, but then it just gives you that kind of actionable, okay, right, this is the picture. These are ways we can improve it. Definitely. And it gives you a more positive outlook. I think just being in the dark of just in the essence of recurrent miscarriage, it's a bloody horrible place to be.
Yeah.
But if you can then draw a line and go, right, okay, this could be the reason why. If we do these changes, like with your expertise and the support that we can provide, etc., and, you know, all the other methods we can use here, then the psychological impact of that is only more positive. Because for me and my own journey, my head was the biggest problem. You know, once I got treated, things flowed like in a more positive way. But up to that point, it'd just been the dark. It's a shit place to be. It's horrible.
Yeah. Well, it's like you know what tree to bark up.
Exactly.
Yeah.
It's so important. Yeah. It's
and being denied access to it is really, really challenging, isn't it? And we know that some of these tests aren't available in the NHS, and the NHS won't advocate the test because it is a different route and it is an out-of-pocket expense. But it is certainly worthwhile considering the advice of, you know, could this test help and where can I get it done if it can help, even if you are in an NHS sort of, referral pathway. It is about asking those questions and saying, could it be this? And then seeking a bit more further advice. And you can go and get these tests done independently and then still come back into the NHS. So it's not as if you're electing yourself out into private healthcare. It just means that you might just need to step out of that cycle, go and get actually diagnosed correctly, treated correctly, and then come back into the pathway if you need to seek further sort of NHS support in that NHS journey.
Yeah, and interestingly, what I am seeing as well is because, you know, people are having children later now, and I'm seeing more people who are getting tests done even before they're trying to conceive. So say with women, and I've been tested, again, because I'm a bit of a geek and interested in this, I've been testing my AMH annually for a few years. And it wasn't because I had the intention to do that. But also, if I was at one point considering having children, it's like it can help to give you a bit of a steer. And because AMH is a test that is indicative of your ovarian reserve. So that can be useful for women to know. But I also know men as well who've gone to go and get a semen analysis just out of interest.
Yeah.
Because they're like, oh God, you know, I've led a lifestyle, you know, and just like, what's the status? You know, people are interested. It's just, you know, when we were saying before about people, you know, getting your bloods done just to see your nutritional status, more people are aware of the tests that can be done now, and just, you know, do it for their own interest. It's like people, you know, wearing like wearable devices and you know, it's telling you all sorts about your health. People are interested in it. And I think, you know, it's a point that we understand that these tests, they can be expensive and they're not accessible to everybody. But for those people that may be in the position to do so, then it can be useful. It can be of interest.
I think that testing and screening, it does need to come with a caveat though, especially for us, especially on the male fertility side, is if you are going to do a test, you need to make sure it's a good test, it's a validated test, and that also you're supported with that result. You know, like you say, there are these home testing kits available, and many of them come with a GP report, which is good. But you have got to be careful of taking these tests, and because if it's a spurious result or there's a problem here, you've got to have that right support around it. And so we've always been a little bit cautious about some of the testing options for a semen analysis because it really does need to be done in a validated way. And you've got to have the support around it, because if it comes back saying no sperm, that is a devastating diagnosis. And we've had many men that have had that diagnosis from a GP and it's wrecked their lives, you know, and turned their life upside down. So I think we've got to have that caveat around that testing and the right professional support with it as well.
Yeah, definitely.
And I think, unfortunately, like, just going back to that point of, like, you know, multiple miscarriages and where patients end up, I remember having a conversation with a woman. I think she'd had 6 miscarriages. She'd gone to a miscarriage clinic and she'd specifically questioned the consultant around DNA fragmentation. And the response was, don't bother with that. It's a waste of money. Just go and get some supplements from Holland and Barrett. You know, and it's like, and I really feel for patients that are getting this conflicting information.
Yeah.
because they're always going to look at consultants and say, they know best. But if they're not seeing the latest research, if they're not, versed in this stuff, these poor patients are just left like, well, now what do I do?
And also, which supplements and how much?
Exactly.
Yeah.
Exactly. So, getting that right advice by a nutritionist, or, go and get some, some proper lifestyle, background, history, and various other, important markers is really, really important, isn't it? Especially if you're embarking on this journey, because it's lifelong, isn't it? If you're having a child, it's lifelong. It's a lifelong commitment. Yeah. So, just
Make
take
sure
a
you're
little,
fit and healthy,
invest in yourself for 5 minutes. Well, more than 5 minutes, but it's about treat yourself as much as what you want to achieve.
Do it properly.
Yeah.
Properly.
So to do it properly, people need to come and find you. How do people find you, Ro?
So on Instagram, I'm at fertility.dietitian.uk, and then our website is www.fertilitydietitian.co.uk.
Perfect.
We will put that in the show notes.
Thank you so much.
It's been brilliant chatting with you.
Oh, it's been so great. I've really
Thank you.
enjoyed
It's
it.
kind of whizzed by,
Excellent.
and I can almost feel like we haven't covered enough, but we've covered so much as well. How would you sum up? What would you say? So a guy that's listened to this and like, what would you say to them?
Number one, male fertility matters. Number two, nutrition plays a role. Think about diet first. You'll often know the things that you need to change. And then when testing, and then, understand the impact that supplements can have when taking the right ones in the right dose.
Yeah.
Brilliant.
Great advice.
That's fantastic.
Perfect. Ro, thank you so much. Thank you for your time.
Thank you.
I almost feel like we need another episode with you. It'll take another 2 years to get you booked in, but I would love to have you back at some point, and we can dig into some of this a bit deeper.
That
Yeah.
sounds
Fun,
great.
isn't it?
Yeah.
Thank you so much for everything you do, and equally taking an interest in fertility. It's great to hear your story and join us today. So thank you.
Thank you.
Brilliant.